I don't think there is any doctor who has not seen a patient in shock. Now, in patients who are in shock, the body, at least in the early stages of shock, tries to preserve blood flow to vital organs at the expense of less vital organs in order to sustain life. Have you ever wondered how this happens or how does the body manage to do this? Welcome to this episode of Doodly, wherein we try to understand how body manages to do this. In order to understand this, we need to go back to physics a bit to see how current flows through an electrical circuit. Here we have a standard electrical circuit, the components being a battery which generates potential difference, the light bulb which offers resistance to flow of current, thereby converting electricity into heat and light, and a wire which completes the circuit. Now, the relationship between these variables of potential difference, current flow, and resistance is captured by Ohm's law, which states that V is equal to IR, that is, the potential difference is equal to flow of current divided by the resistance. Rearranging this equation so as to get the flow of current or solving for I, we get the equation as I is equal to V by R. That is, the flow of current I is equal to the potential difference V divided by resistance R. From this, we can understand if the potential difference in the circuit driving the flow of electrons is high, we have higher current flow. Contrarily, if the circuit offers more resistance, the flow of current would be less. Now, let us replace a simple circuit seen in the previous slide with a slightly more complex one where we have 3 instead of 1 light bulbs. These bulbs are, as you can see, parallel to one another. This represents a typical parallel circuit. Now, if the bulbs are connected one after the other in the circuit, that would be called as in series. Now, one of the characteristic feature of a parallel circuit is V, the potential difference across all the light bulbs is same. From the previous slide, we know solving for I, that's a flow of current, we get flow of current is determined by potential difference divided by resistance. Now, as we have seen in a parallel circuit, the potential difference across all the light bulbs is the same. So that is V remains same. Now, what determines the flow of current through each of the light bulbs is R, that is the resistance offered by the individual bulbs. The bulb which offers less resistance sees more current flow, while the bulb which offers a higher resistance will have a lesser current flow through it. Now, let us replace this electrical circuit with the heart and the cardiovascular tree as represented in the subsequent diagram. The pulmonary circulation is represented on either side of the heart, and the systemic circulation and its components are represented above and below the heart. Each branch of the artery and the capillary circulation represents an individual organ system. Now we can note that the pulmonary and the systemic circulations are in series with each other, while the individual organ systems in the arterial system or the systemic circulation are parallel to each other. Now, in this picture, the heart replaces the battery. The contraction of the heart generates a pressure in the aortic root. The difference between the aortic root pressure and the right atrial pressure becomes the driving force for the blood to flow from aorta back to the right atrium. Now, the I, the flow of current in the electrical circuit, is now replaced by the flow of blood. As we note, the flow of blood through individual circulations or the capillary systems encounters a certain resistance to its flow. This represents the resistance offered by individual organ systems. Now, as we noted in a parallel circuit, the resistance offered by each circuit will determine the amount of blood flowing through that circuit. It is important to understand this. In the next slide, we have the same picture as we saw in the previous slide. Each branch of the artery and the capillary circulation represents one organ system. As noted, all the organ systems on the systemic circulation are in parallel with each other, re-emphasizing the aortic root pressure determines the pressure head which causes blood to flow through each of the organ systems. It is the same for all the organ systems. However, the resistance offered by individual organ systems determines the flow through each of them. Now, in a patient with shock, as we know, there is increased sympathetic outflow. This sympathetic outflow acting on the heart increases the heart rate and contractility, while acting on the vasculature causes severe vasoconstriction. This increases resistance in the vascular tree of all the organ systems. However, the vital organs like the brain, the heart, and the kidney, which have a much higher degree of evolution of the autoregulatory systems, are able to override this vasoconstriction and reduce the resistance offered. Thereby, they maintain their blood flow in the context that blood flow is reduced to non-vital organs because of severe vasoconstriction induced by sympathetic outflow. The blood is diverted from less vital organ to the vital organs. This is how the redistribution of blood happens in a patient who is in shock. Hope this was helpful. Thank you.